68-year-old man who is diagnosed with deep vein thrombosis, DVT. So focus on the disease, DVT, deep vein thrombosis, and started on an anticoagulant. In bracket, some names are given. LMWH stands for low molecular weight heparin, then another warfarin or dabigatran, etc. So question is saying that he was started on an anticoagulant. In bracket, three names are given likewise. To prevent thromboembolism, 2 weeks later, he presents to emergency with epistaxis and bleeding per rectum. What should be done for treatment of this patient's presentation? So this is an example that we have taken, that number one thing, anticoagulants are used for treatment of thrombotic disorders like deep vein thrombosis. Okay, so think of anticoagulant when you come across diseases like deep vein thrombosis. There are several anticoagulants. One of them is low molecular weight heparin, the other one is warfarin, the third is dabigatran, and there are few others. When we give anticoagulant, sometimes the excess action can occur. You can give overdose, so excessive action can occur, and that would result in bleeding. So anticoagulants are given to prevent thrombosis, but their overaction can lead to bleeding. Now, depending on the type of anticoagulant, we will have to choose a particular antidote or treatment. So that is what this question is asking, that if you give overdose of anticoagulant, patient will have bleeding, how will you treat them? So this is one of the most important point that is asked in MCQ and also in clinical practice. So as a physician, whenever I am giving or using any anticoagulant, the first thing I want to know, what is the antidote if bleeding occurs in this particular patient due to overdose of this anticoagulant? So that is one very, very important question that is asked in MCQ and that the clinician should also know, and that is what this clinical case is trying to point our attention to. So as we go along in our discussion of anticoagulants, we will see what are the various anticoagulants and what are the antidotes for treatment of their bleeding. Okay, so that is what we will learn in this particular chapter.